And again, ladies and gentlemen, if you look at your watch and the program, yes, we are a little bit behind, but we do run the clock the full time for everybody, and we're going to cut into your lunch hour a bit, so when at lunchtime, eat quickly. But in the meantime, as soon as we're get the flight, okay. Ladies and gentlemen, one of the pleasures of being and benefits working with the Cancer Control Society is Lorraine and I get to travel around the country and we get to meet very good, exciting, interesting people that know a lot about cancer medicine and those things. And Dr. Brad Weeks is one of those that we've met. He's spoken here before, and it's interesting too because some of the people we have up here not only are MDs, they're also psychiatrists. They've been trained in two different fields. Dr. Weeks is one of those, mentored by Dr. Abram Hoffer, co-founder of the Orthomolecular Society, and worked with Jonathan Wright, among other things. And so we're very happy to have you. And he's talking about a subject that is extremely important today, and that's the cancer stem cell. Dr. Weeks, thank you very much.
Frank, thank you. Greetings. Well, I'm going to start with a quick little story. Most of my patients are smart enough to ask me about a cancer diet. I'm just going to recount this quickly because about 25 years ago I studied with Michio Kushi, the macrobiotic diet guru. Very interesting time. And people struggle with this quite difficult, challenging, somewhat dour diet where you start to appreciate the bouquet of brown rice after the 12th day. But so they asked Dr. Kushi, what is your cancer diet? And he says there's 3 rules. Number 1, pause before the meal. Pause before the meal and appreciate that somebody fixed it, somebody picked the rice, somebody transported it, somebody made this meal happen. If you don't pause, we know from a scientific perspective, you won't get into the parasympathetic, relaxed phase where you can actually digest and absorb your nourishment. Number 1 rule, pause with appreciation. Number 2 rule, chew, 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 chew your food. Do justice to what you've received. And only number 3 would he talk about specific intelligent food choices. So I'm going to give you in 25 minutes what can only be described as fast food. I would love to take a couple hours and detail this. You're going to get a fast food diet. So before we do, I just wanted to pause because where were you 40 years ago? What were you doing 40 years ago? Well, if you think what you're doing 40 years ago, that's how significant this Cancer Control Society effort is. 40 years, that's a huge amount of time. And who were you with every year? Maybe you had a family reunion every year. Did you do anything every year for the last 40 years? Maybe Christmas with family, but probably time with loved ones would be what you did every year for the past 40 years. Well, what has Lorraine and Frank and all the wonderful volunteers done? They've created a reunion for loved ones to get together every year for 40 years, and I think that's quite significant, and I'm very appreciative to be here. Now, what else happened 40 years ago? That's when Nixon created the war on cancer, right? Approximately 40 years ago. And I think we're winning compared to the conventional protocols, thanks to Lorraine and all of you talking about what you know. Now when somebody gets cancer today, it's not more than a few minutes before they're starting to think about alternatives to conventional cancer care. That is a very significant accomplishment that we all can pat ourselves on the back for. Now, the war on cancer, I don't like the language. I don't like war. So nonetheless, before I desert that war metaphor, it requires 3 things to wage a war successfully. You need leaders with vision. Lorraine, some of the researchers, some of the people who are sharing the vision. You also need soldiers. You need heroes, you need martyrs, you need patients and doctors to try their best. And lastly, what do you need? You need supply lines. Any of the generals will tell you they can't win the war unless the supply lines are intact to feed the troops and deliver technology. So I wanted to also thank all the vendors who are here teaching us and sharing and themselves being courageous about what they're bringing to us. So thanks to them. The other thing that happens in wars is a revolution. So what I want to do is to remind people that There is a revolution in cancer today. If you don't know about it, that's one of the most important messages. I'm going to drop 4 names. Everything I talk about here is on my website, weeksclinic.com. So if we go too fast, you have those resources. But 4 names. These are the premier researchers in cancer today. One of them, Robert Weinberg at the Whitehead Institute in Cambridge, wrote the book on cancer, Cancer Biology. And Robert today says, if we want durable clinical responses, we need novel treatments. Chemo, radiation, and surgery, according to the premier thinkers in cancer today, will not suffice. There is a revolution afoot today. You need to know that when you talk with your oncologists. Max Wicha, distinguished professor of oncology, University of Michigan, Comprehensive Cancer Center, says chemo and radiation will make your cancer worse. He's not alternative. Okay? There's a revolution, ladies and gentlemen. Max Dean, who directs the Dean Laboratory at Stanford, same thing. Radiation will make your cancer worse. Now, you haven't heard about this from your oncologist, but that's always the case, that the leaders teach. There's a time frame, a voltage drop before, the people, the good, hardworking oncologists who I hold in the highest esteem. These people get out of bed every morning wanting to do the best they can. We can't have a war against our oncology colleagues. We have to have compassion. And the last name to drop is Irving Weissman at Stanford also, who's saying that unless you address the cancer stem cells, you're wasting your time. So I'm telling you about cancer stem cells today, and I'm happy to say that what I consider to be the smartest researchers in cancer today are on board as well. So I want to start with a scientific question. We want to talk about science methodology quickly. I'd like, please, a show of hands of anyone in the room who can tell me that they know someone who died of cancer. Now, that was a trick question, because as a scientist, and I'm sorry for your losses, of course, as a scientist, you can't say they died of cancer. They may have died of the treatment. I'm not surprising you here, but science is about isolating variables and making a conclusion. Be careful when you say that someone died of cancer. Now, it's interesting to know that The Economist, December 4th, 2011, The Economist, quotes a lot of issues with, has an article about chemotherapy and radiation, conventional cancer care. Alan Levine says, a medical doctor, most cancer patients in the United States die of chemotherapy, period. Not of cancer. Women with breast cancer are likely to die faster with chemotherapy than without it. Okay? As a chemist, says Alan Nixon, former president of the American Chemical Society, as a chemist, I am trained to interpret data, and it is incomprehensible to me that physicians can ignore the clear evidence that chemotherapy does much more harm than good. Former president, American Chemical Society. I'd like to see a show of hands of everyone who knows someone who died of cancer. 1 or 2, thank you. Okay, now, cancer stem cells, we're honored to have Nick Gonzalez talk later about his excellent work with this theme. He wrote some great books in the back, but back in 1911, John Beard talked about the germ cell. So it's a definition of terms, cancer stem cell, cancer germ cell, but here we go. The goals for presentation today are to clarify the distinction between the cancer stem cell and the cancer tumor cell. I want to communicate the importance of addressing these stem cells, and I want to share what we do at our clinic for comprehensive or corrective cancer care. And most importantly, don't leave before you get the fun thing at the end, the 4 questions you have to ask your oncologist in order to optimize your care. So a summary of clinical case studies. This is just a brief summary. These are not cherry-picked. This is typical cases in our clinic. I like to start, especially if it's fast food, I like to start with dessert first. So here's the fun stuff. Here's a gentleman, 65 years old, came to me, multiple areas of abnormal metabolic activity with his Hodgkin's lymphoma. He lit up all along his spine, multiple lymph nodes, and also skeletal lesions. We did our what's called corrective cancer care, which involves things we'll describe, including insulin potentiation therapy, and within 2 months, quote, remarkable improvement, near complete response, and then 6 months after starting, no evidence of PET-CT for residual or recurrent lymphoma. It's a happy story. This is a very nasty type of a cancer, a leiomyosarcoma in the uterus, stage 4, Mets to the lung. Initially, all over the place, after just 2 months of treatment, the innumerable bilateral nodules and lesions have all decreased in size and number, and then about 6 months after treatment, essentially all of the pre-existing metastatic disease are smaller or less dense, no new lung metastases. An evidence of breast cancer case, triple negative, very nasty. Metabolically active lesions in the left breast and axillary nodes consistent with diffuse metastatic disease. After 6 treatments, nothing seen on a PET CT. And by the way, if you're going to get scanned, you really need a PET CT for reasons discussed earlier and yesterday, that it shows the metabolic activity of the cancer, not just the size. Lung and primary breast cancer. I've only had a few patients who have 2 types of cancer simultaneously. This gal worked at Hanford Nuclear Reactor Site as a teenager and got exposed. And despite conventional care, both her lung and her breast metastatic disease grew. And after 6 treatments, lung cancer no longer present, no evidence of progression or new malignancy. Her oncologist said, "You're cancer-free." Never called me to ask what I was doing. Pancreatic cancer strikes fear, unfortunately, in people's hearts. This is a gentleman with a lot of problems, alcoholic, obese, pancreatitis, diabetes, etc. The well-defined mass. In November, he was given 3 to 6 weeks to live. He refused care and came across the country from New York for corrective cancer care. And after 4 weeks of treatment, everyone's astonished at the PET CT done, quite heartening, lesions 1/3 the size, would have expected he'd be dead by now. And then in July of this year, all they can find is pancreatitis. Breast cancer again, locally invasive, extensive locally invasive disease, bones, hilar nodes, and so forth. After 6 treatments, nodules no longer present, no evidence of cancer. Prostate cancer, same story. This gentleman happened to be a nutritional doctor as well. Prostate cancer, the doctor said, "You're in big trouble, and you need to stop golfing because your bones are so metastasized, you're going to have to stop golfing or you'll break your back." So he said, "That is too much." He went to corrective cancer care, and pain went away after the first IPT treatment, the metastatic bone pain, and at this point, no evidence of bone metastatic disease. PSA is normalized. Another pancreatic cancer patient, well-defined mass on the initial PET CT after 6 weeks of treatment, no evidence of cancer, no mass identified. So this is very good news. This is something's going on where cancer shouldn't be feared so much, and there's maybe some rational approaches if you pay attention to the cancer stem cells as well. This is the logo of our clinic. We always treat people with cancer. We never treat cancer. It's a significant distinction because we believe that cancer is a highly individualized treatment, and it depends upon the human being, the context within which the treatment, the compassionate treatment takes place. We pay attention to the physical body, the etheric body, the soul, and the spirit. The physical body, after all, is just our life support system. It is not us. So if you're treating the physical body by lumping off a breast cancer and not addressing the process, you're missing, I think, the significant piece. Now, this is as much a slide for me to remind myself as for you. Which box are you thinking outside of? We congratulate ourselves for thinking outside of the box, and we're unaware that we're probably just within another box. So we have to keep the process of always being open-minded. But let's define some terms. Play with me here. I don't mean to in any way belittle the tragedy that happens with people suffering from cancer, but I want to have you start to think about this a little bit differently. What is cancer? What is a dog? Growing up, I had a husky. I knew what a dog was. My daughter got a dog. I wasn't sure what this was. I had to think outside of the box. It is a dog, and we've fallen in love with it despite new puppy syndrome. But, you know, a lot of us know what cancer is. It looks like this, and this doesn't make sense. So we have to widen our perspective. So cancer, I would suggest, in terms of classical Chinese medicine, cancer is an adaptive response to the problem. It's not the problem. Okay? And often, it's a wise adaptation to the problem. Outside my house, we have, up in the Seattle area, we get a lot of fungi on trees. Tell me, ladies and gentlemen, if I showed you this tree and then I took a sledgehammer and knocked that off, could I convince you that I'd healed the tree of fungus? Of course not, because you don't get the blossom, the cancer, unless you have a process underway. Now, if this were a breast and I cut it off because there was a tumor right here, Is the person fine? I would suggest not. Thomas Pynchon in Gravity's Rainbow, if you get people to ask the wrong question, the answer doesn't matter. Current goal, current question, the patient says, I want my doctor to kill my cancer cells and shrink my tumor until it disappears. I would suggest that's the wrong goal. Don't kill the messenger. Cancer is the message of a systemic toxicity. And cancers, like all symptoms, have a wisdom. It's often a healing gesture. Quick last quotation. Tom Robbins' great books. Dr. Yamaguchi, a fictional cancer doctor, is he's being interviewed about how he's going to conquer cancer. He says, what do you mean conquer? What do you mean destroy? Western medicine all the time try to think in terms of destruction. In the West, you get a virus, he wished to kill it. Get tumor, wish to fire a magic bullet. Not a healing, but a gunfight, like the OK Corral. My method, not warfare. My method is pacify. I like this. Make friend with the tumor. Friendship with cancer. Change your friend's diet. Teach friend good manners. Different approach, ladies and gentlemen. So here we are. I try to pay attention to the net, nutrition, exercise, and thought. These are the variables we pay attention to. And of course, the metaphor is if you get an illness, why take drugs? Synthetic. Just like if you break down in the car, why spend the rest of your driving career being towed when you can simply correct the problem? You can add gas, you can put air in the tire. Why do we so easily get pushed into taking a synthetic solution analogous to being towed around by a tow truck when you can fix the problem? So the 4 steps to corrective cancer care are to take down the cancer welcome sign, that process, enhance the immune system, kill the cancer tumor cells, but also re-educate, control the cancer stem cells. Metaphor is if you're in a rowboat with me and there's a hole in the boat and we're sinking and there's a couple of buckets, let's bail, of course. But if that's all we do, we will eventually tire and drown. Someone has to plug the hole. Chemoradiation and surgery is just bailing. Does this make sense? You have to plug the hole. You have to think there's a hole and plug it. I use fermented soy. I use the Healin product. I think it's a superb product. The science itself could take a 4 or 5 hour lecture. But in 1991, $20 million were spent not to find out cancer agents in foods, but which foods or which specific aspects of cancer-killing foods were active. And there are these 5 compounds: isoflavones, protease inhibitors, saponins, phytosterols, and phytic acid compounds, and they're all in the soy plant. This is another big lecture just to remind you, estrogen receptor is not a bad thing. There's alpha and beta. Alpha is bad, beta is beta. Remember, beta. You want things to stimulate your estrogen receptor beta. Okay? Soy does that, and numerous other things do that. I'm not going to talk about all the remedies for cancer. You'll hear about that from different people, but I believe if you look closely enough, everyone is beautiful. And I believe in time, scientists will find that every plant today alive on the earth has anti-cancer properties. It's not just grapeseed extracts or something else. All the plants are medicinal. Oxygen is tremendously important. Frank does us a great service, Frank Schallenberger, to remind us of that. You can actually increase your red blood cell production with oxygen. And fasting, the question I asked him yesterday. Fasting actually makes cancerous cells more susceptible to chemotherapy. So that's important. What do oncologists do? They feed you all sorts of sugary foods to keep your calories up. Go fasting. Nice quotation from St. John Cassian: stop eating while still hungry, and do not continue until you are satisfied. Okay, cancer tumor cells versus cancer stem cells. We're not talking about these stem cells that make you beautiful and make things grow. And I referenced John Beard, 1911. And of course, any pioneer gets arrows in the back. And the modern discovery was really traced back to 1994 when people started paying attention to cancer stem cells. But I want to make the point that in a tumor, less than 0.1% of the cells in a tumor are stem cells. Less than 0.1% of the cells of a tumor are dangerous. Only the cancer stem cells metastasize. I would like everyone to repeat that. Say that. Only the cancer stem cells metastasize. I want you to remember that because that's a scientifically accepted fact. And what in the heck are you doing getting cancer treatment with an oncologist who's not paying attention to your cancer stem cells? Cancer stem cells, like normal stem cells, resist chemotherapy, and they resist radiation therapy. So they're not going to be affected by conventional treatments. Why do cancers resist chemotherapy? Lots of reasons to go through, but in essence, cancers resist chemotherapy because cancer stem cells resist chemotherapy, and if you don't address the cancer stem cells, the cancers will come back. So, is this making sense? Now, there is a revolution I alluded to earlier, and we have people like Max Dean at Stanford saying that chemotherapy makes the stem cells proliferate, and chemotherapy increases the number and the virulence, makes them more lethal. Dr. Lee. The research is out there. Max Wicha in Michigan. When we treat cancer cells with chemotherapy, the cancer stem cells are being stimulated too. So the concept I want you to understand is if you are the sheriff and you have to put down a riot outside, the riot will be composed of 3 categories of instigators: the ringleader, the lieutenants, and all the other people who are just kind of tagging along. Okay? So you send one sheriff to go tell the tag-along people to go home because it's going to get kind of ugly. You send another sheriff, a deputy, to go after the lieutenants and say, I don't know how loyal you are to your boss, but you better go home. And then when you confront the ringleader, it's a better deal. The tumor cells, the cancer tumor cells, are the bystanders in this process we call cancer. They are not dangerous. If they grow too big, they can shut down an artery or something, but in essence, they're just kind of a tag-along cells which have been whipped up into the fray. It's the cancer stem cells which are the ringleaders we have to go after. And the top researchers in the field know this, and you need to make sure your oncologist knows this. This is a nice article in the Pittsburgh Gazette in February of 2010 when Max Wicha was interviewed. I'm not going to read it, but it's on the website and it's available. Basically, he says that chemo and radiation will make your cancer worse. We also know that chemotherapy can stimulate cancer stem cells. We know this from some of the new breast cancer drugs, anti-angiogenic agents. Now here's another paradox. This is a gentleman who runs Harvard Mass General Hospital, Dan Haber. Mass General Hospital, MGH, I trained there for 2 years. It's called, MGH stands for Man's Greatest Hospital. And so if this fellow is saying shrinking the tumor is not always correlated with longer survival rates, when your oncologist says, look, Mildred, your tumor was this big and now it's this big, aren't we doing great? You have to know that that's not necessarily a foregone conclusion. Tumor shrinkage is not necessarily helpful. Why? Any injured tissue, when it is injured, will solicit from the mesenchymal stem cells, not the cancer stem cells, the mesenchymal stem cells, it will solicit a response. It's like an SOS message that says, I'm injured tissue. Are there any of you out there that could come and repair me? And in come the second-line warriors, these undifferentiated, young, premature stem cells ready to make more of you. A stem cell, by definition, is a cell which not only can create itself again, but a differentiated cell. So a stem cell divides into itself and to a more developed cell. So a stem cell can recreate itself. That's why it's eternal. And so they're ready to make more gut cells if you have an ulcer or if you lose your hair, to make more hair cells. Those cancer stem cells will be brought to an area of injured tissue and become that tissue. Guess what happens when you attack with chemo and radiation of breast cancer? Tumor. That tumor puts out an SOS message, interleukin-8, an inflammatory cytokine that says, hey, are there any stem cells out there willing to make more of me? In come the stem cells. And they say, by the way, what are you? I'm a breast cancer. Oh, good. We can make more of that. That's the mechanism of how cancer stem cells make more cancers. So there's new directions in oncology, and this is kind of exciting stuff. And again, you want to be able to maybe go to the website, weeksclinic.com, print this out, and give it to your oncologist. It is likely that combinations of cytotoxic, conventional, biologic, things we hear here, and cancer stem cell therapies will be ultimately allowed to make the most important contributions. The current model, says Dr. Max Wicha, may not be getting us anywhere. We have to target cancer stem cells. So how do we do that? Well, we know that tumors are wounds and they're inflammatory processes, so we need anti-inflammatory agents. Here's a lot of work with anti-inflammatory agents. Dr. Wicha uses this receptor blocker. Soy does this, especially the fermented soy. Many other things can go after the inflammatory process. Soy decreases these cytokines, including the inflammatory interleukin-8 I've talked about. It also promotes cell differentiation. It takes a stem cell and makes it into a normal cell, making it more vulnerable. The fermented soy transforms circulating cancer stem cells in humans into more differentiated and therefore more targetable, treatable cancer stem cells. Also metformin. Make sure you Google metformin in cancer. It selectively kills cancer stem cells. A lot of research on that. Eradication of cancer stem cells is one of the things it does. That's a 2011 article. Metformin is something you have to pay attention to. It works by helping you with lowering your blood sugar. Fish oil derivatives kill cancer stem cells. Chrysin kills cancer stem cells. Adjuvants like these, they re-educate the confused cancer stem cell. They help it differentiate into a target or normalize. It interrupts, the goal is to interrupt the interleukin SOS message, right, that says make more of me. We want to have a pro-apoptotic agents like iodine, soy, and genistein. We need to stimulate the beta, the estrogen receptor beta, which is the beta receptor. And also we want to decrease alpha, which is dangerous for the estrogen receptors, target the cancer stem cells, metformin and soy, enhance the immune system. Do that by minimizing fear and anxiety, stopping this concept of a war, befriend the cancer, and enhance the sense of purpose and appreciation in life and love. So in summary, cancer mortality is directly related to cancer stem cell activity, not the size of the tumor. Don't be seduced into shrinking your tumor and thinking you're making progress. You may be, but it's not necessarily the case. Number two, chemotherapy and radiation do not kill cancer stem cells. Number three, chemotherapy and radiation actually make cancer grow faster and become more virulent. Number four, treatment of people with cancer requires adjunctive care and not just chemo and radiation. And treatment which fails to address the toxicity of cancer stem cells is futile and irresponsible. IPT, while kinder and gentler, is still chemotherapy, and we need to be doing adjunctive care as well. And that the IPT and the corrective cancer docs are leading the way. This is the therapeutic message which our patients as well as our colleagues are ready to hear. So the take-home message is that there is an earthquake at the foundation of oncology today. Killing the tumor is the standard of care, but leaders are recommending new directions. And the new direction is what we and our colleagues have been doing all along. When the plant is sick, treat the soil. Treat the person, make the person healthy. So the time is now to offer this type of corrective cancer care. So the 4 questions for your oncologist. Please remember these. Dear Dr. So-and-so, are you able and willing to enhance my health and vitality while killing my cancer? Now, if you get a kind of a confused look, you might want to bear that in mind as some important data. Number 2, what chemosensitivity testing will you do to determine which chemotherapy agents to use? There's Greek tests, there's German tests, there's a lot of ways to know what your cancers would be most sensitive to before just blindly wading in. Number 3, how will your proposed cancer treatment affect my lethal cancer stem cells? Number 4, how are you planning to interrupt the interleukin-8 SOS message? I mean, this is if the oncologist is still in the room. You won't. But how are you planning to interrupt the interleukin-8 SOS message my targeted and dying cancer tumor cells will emit in response to your chemotherapy and radiation? Gentlemen and ladies, I thank you for your attention. It's an exciting topic, and the revolution is underway.